So today I asked if they anticipate another shutdown and why the eastern Coachella Valley continues to have one of the highest clusters of coronavirus cases. I spoke with Government Affairs and Public Policy Advisor Greg Rodriguez. Greg, thanks for joining us.
Thanks for having me, Peter.
Today, the governor made some big announcements regarding indoor businesses and what can and can't be open right now. What is the county's reaction and what does this mean?
Yeah, well, as you know, Peter, we have aligned ourselves completely with the state now over the last few months. And so we will definitely abide by the governor's order. Obviously, probably a little disappointed. I am specifically about the gym because I thought my gym was doing a really good job. But I think we've got to look at the numbers, and we've seen not only the numbers in the valley here go up, but across Riverside County as well as the state as a whole. And I think the governor has really looked at the data and has determined that a lot of these indoor gatherings, looking at the data, in conjunction with the public health department, has determined that a lot of these indoor occurrences tend to make more people gather closer together, and we see the spread much quicker.
You mentioned your gym. This is difficult because a lot of businesses had been following the rules, had been doing things the right way. Your heart must go out to them and the financial impact that this is going to have on a lot of business owners.
Yeah, it really does. And, that financial impact already hit once. And then I think this gave a lot of people some hope. It did our office and the supervisor about, if we can do this in a safe way, protecting both the business owner, but as well as the customers, that maybe this would provide a little bit of financial relief. However, now that we're having to go back into somewhat of a modified lockdown, it is going to hurt. It's, a lot of it is personal responsibility, Peter. And unfortunately, to your point, businesses have really abided by the safe guidelines that the state and the county have put out. But if you do not have individuals that are willing to wear masks, or if you have people congregating too close together, that's why the governor's had to take the action he has.
The last time there was a shutdown, there was a lot of backlash. Things got pretty contentious. Are you anticipating that to happen again?
I'm not, and you never know. You can never say never, but our businesses have been really compliant through this whole thing, starting from the day one when we started the first closure. We've seen a lot of businesses that have had employees of their own become positive and sick. And so I think many of them will see this as a protective measure. Hopefully it will not have to last long. Hopefully I believe that the message is getting out there better. You can see just by the sheer number of tests that we're doing in the county that more people are demanding testing, that we're being able to provide that. And so again, I hope it doesn't have to last that long.
How will this be enforced in light of the fact that Riverside County Sheriff Chad Bianco says he does not plan to do any enforcement on these regulations?
Yeah, and that's a great point. And I think the hardest thing to enforce is the face coverings. And again, that comes down to a lot of personal responsibility. In all actuality, Peter, when we went through the first round of closures, businesses were very compliant, at least especially here in the Coachella Valley. I can't speak for everywhere in the county, but they got that this was a public health crisis, and it still is. And again, they not only want to, run the risk of their customers getting sick, but also their employees well. So we don't anticipate if it comes down to enforcement, especially restaurants and bars, we can utilize the county environmental health department that already enforces food safety laws. If it got to the point with bars, which we won't anticipate them opening, we would, follow up through the alcohol control board.
The eastern part of the Coachella Valley, communities like Thermal, Mecca, and Indio have been hit especially hard by the coronavirus, with more cases per 1,000 people than any of the neighboring cities in the Coachella Valley. Why do you think that is?
Yeah, there's not a real definitive answer, but we can do some speculation. And again, some of this is based on the data that we've seen. Indio, itself is the largest community in the valley, so just by sheer numbers, they will probably test more anyway. But overall, and not just the East Valley, but places like Desert Hot Springs and Cathedral City that have a high frontline worker population. So whether that's in the hospitality industry, whether it's agriculture workers like in packing plants. Additionally, Though it tends to be somewhat of a cultural issue too, as you know, a high Latino population. It's very hard to break the familial culture that the Latino community has. You also have households that are multi-generational, and so you can have various people within that household working in different sectors of the economy, and then possibly doing infections. So there's not real one definitive answer, but what we're really encouraging, what the supervisor is really encouraging, and our public health department is try and social distance as much as possible, alleviate the large family gatherings, stay within your own household, and definitely do the facial coverings.
On Friday, the county announced that it had reached 100% ICU capacity. What does that mean?
Yeah, so it's important to know that those ICU beds that at the capacity is the actual licensed ICU beds. In April, our county public health department, working with all 17 hospitals in the county, developed what we call a surge plan. And that basically takes into account, if we get to capacity of hospitals, how are we going to deal with that? So those surge plans have been implemented at all 3 of our hospitals here in the Valley. And what they have done is that in order to create more ICU beds, we are able to convert some of the regular beds or wings into some ICU facilities. I've actually had some good news come out today that our ICU bed capacity is a little bit down in the county. And so we're not at a point, Peter, where we can't take anybody into the hospital or into ICU. We have not reached that point, and we believe that the surge plans that all 17 hospitals in the county have will make sure that we have the right bed capacity.
All right, Greg, we appreciate your time. Thanks for joining us.
My pleasure, Peter. Thank you so much.